This technical note describes arthroscopic anatomical lateral ankle reconstruction using allograft, a simplified approach. Clinical ankle joint instability is confirmed preoperatively. The graft is prepared by passing a 2-0 fiber loop with a straight needle through both ends of the graft. A biotenodesis screw system is placed at one end of the graft. A first line is drawn along the posterior border of the fibular shaft and a second line is drawn perpendicular to the first line and passing through the tip of the lateral malleolus. The calcaneal portal C is located 1 cm distal and posterior to the intersection of the two lines. After making a small skin incision at the marked calcaneal portal, a guide wire is inserted into the calcaneum directed to the posterior and inferior medial edge of the calcaneal tuberosity. The guide wire is overdrilled using a 6 mm cannulated drill bit, and a number 1 loop suture is positioned in the canal. A standard arthroscopic anteromedial and anterolateral portals are created. Systemic exploration of the joint line is conducted to identify additional intra-articular lesions. The remnants of the ATFL serve as a landmark to identify its distal talar insertion. Then a guide wire is inserted in a posterior and slightly upward direction toward the tip of the medial malleolus, while being mindful to avoid the penetration of the sinus tarsi. The guide wire is overdrilled using a 5 mm drill bit to create 20 mm length talar tunnel. An 18-gauge needle is used to create subtalar portal, targeting the fibular obscure tubercle. A guide wire is inserted through the fibula in a posterior oblique direction to obtain a long oblique fibular tunnel. Then the guide wire is overdrilled with a 6 mm drill bit to obtain a 15 mm depth long oblique fibular tunnel. A number 2 loop suture is placed within the canal. A curved mosquito clamp is inserted through the anterolateral portal and slid along the lateral talar and calcaneal wall, reaching the calcaneal portal to avoid sural nerve injury. Then the loop sutures number 2 and 3 are retrieved from the cannula. The allograft is passed through the cannula from the anterolateral portal and fixed in the talar tunnel using a biotenodesis screw. The cortical endobutton is placed on the allograft, which is pulled from its end through the calcaneal portal using the loop of the lead suture number 3. The loop suture number 2 is used to pull the endobutton into the fibular tunnel, and the graft is gradually pulled up to fill the fibular tunnel. The endobutton is positioned on the lateral fibular cortex without tightening. The allograft is fixed into the tunnel using a 6 mm by 15 mm biotenodesis screw while maintaining the ankle and the foot in neutral position. Final ankle joint testing is performed to confirm ankle stability. Thank you for listening.